First matters.
Governor, you're talking right now about making peace with Donald Trump, with the president, and yet you went on television 4 times this morning and were asked about it and opined about it repeatedly. You called him a king. You said that his press briefings were like a comedy sketch. Why didn't you just say no comment if you're trying to make peace with him?
No, the first point is he does not have total authority. I mean, I'm a governor of a state. The statement that he has total authority over the states and the nation cannot go uncorrected. I mean, it's just a factual statement that is factually wrong. 10th Amendment to the Constitution. There's a whole body of case law. I mean, there are many things you can debate in the Constitution because they're ambiguous. This is not one of those things that is ambiguous. So that statement cannot stand. And it's not only violative of the Constitution, it's violative to the very concept of democracy. I mean, this was the first battle. Do we want a king or do we want a president? And we opted for a president. So that statement cannot stand, period.
Hominem attacks, calling him a king, saying that it's like a comedy sketch, saying
No, that's not.
It's 22 hours.
His proclamation is that he would be king. That's what a king is. A king has total authority. That statement cannot stand. The whole mutiny on the bounty, the governors are mutineers, whatever that means, and whatever the rest of the theory was. I'm not going to fight. I'm not going to get into that fight. Look, I bent over backwards. He said a nasty comment about what it was, but he's right. I worked very hard to be in partnership with the federal government this past month. I worked very hard to stay away from politics. And he is right. I did call and say I need federal assistance. I did call and say I need possible overflow beds. That he is right that he did move very quickly to get us Javits and the USNS Comfort. And I said that repeatedly. And I praised him for his actions. And he was right there, too. The federal government has a very important role. I was a cabinet secretary. I did it for 8 years. I know how key the federal government is. Frankly, I know how powerful they actually could be in being of assistance. And I don't even think they were as powerful as they could be. And the federal government has tremendous, tremendous capacity that we need now. So, yes, he's right on all of that. He's right that we asked for cooperation and assistance. And he's right that he delivered. And I've said that all along. But this mutineers and it can't exist.
Why is the state releasing the name of nursing homes and how many COVID cases and fatalities are?
I don't have anything specific to talk to him about today. There's no action item for us to talk about.
Do you think you need to talk to him after what's been going on?
I have no, it'd be my pleasure to speak with him, but we don't have anything that is, do we have anything pending? No. I did speak to the White House this morning about a hospital matter. But other than that, we don't have anything immediate.
What was nursing homes and how many COVID cases
Have you received any guidance from the president about your role in the reopening? You said yesterday that he hadn't given governors any guidance in their role.
No, we haven't had that conversation. And look, this is a shift in federal position, which is also fine, by the way. We're entering a new phase, the quote-unquote reopening phase. On the first phase, which was the close-down phase, the president took a different tact. The president did not close down the economy. He did do the travel ban with China, and he was right on the travel ban with China. The close down of the economy was left to the governors. And I closed down New York, Governor Pritzker closed down Illinois, Governor Lamont closed down Connecticut, did it different times, different ways. But he left that responsibility, the closing down of the economy, to the governors. You get to the reopening of the economy, well, the governors closed it down, wouldn't the governors reopen it? The president says, no, I have a different model that I'm envisioning. That's okay too, but it's a shift, but it's okay. But then what is that model? And let's talk about who does what, which is the intelligent conversation we have to have. How do we do this testing? How does that come up to scale? I can't do it. How do we do this technology? And I understand he's right, it raises constitutional questions. And do you really want that cell phone in your pocket to be a tracking device, right? Okay, so let's talk through how we do that. How do we disinfect a public transit system? That has to be understood. How do we have masks for every New Yorker? How do we do that? How do we get 10, 20 million masks so we have that added protection? How do we get gloves? How do we make sure, God forbid, there's a second wave where there's another uptick, that we have the medical equipment we need after we just went through this horrendous hurry-up exercise? By the way, where's the funding for states to help do this? I'm broke. You know, there's no fancy way to say that. We have a $10 billion deficit. Well, the state should do this and do this and do this and do this. I don't have 2 nickels to rub together. And the past federal legislation didn't give us anything. The only thing it gave the states was some Medicaid money. It doesn't give us anything to do any of this. They talked about it in the next package of legislation, if there is one. But that's the intelligent conversation to have.
Will he speak with you about it right now, or will he have this conversation with you?
Yeah, I have always had an open line of communication with him. I mean, there have been times in the past when he hasn't been happy with me and I haven't been throwing bouquets to him, but we've always communicated, and I'm sure we'll communicate now. But I just want to make my position clear. I am not going to fight with him. I don't want, this is no time for any division between the federal government and the state governments. And the governors who I work with, Democrats, Republican governor in Massachusetts, it's not a political conspiracy. Governor Baker is a Republican. This is not about Democratic or Republican. It's just not. This is about New York, 10,000 lives lost. These were not 10,000 Democrats or 10,000 Republicans. These were 10,000 people, period. Forget the darn politics. Everyone's tired with it.
Why is the state releasing the names of nursing homes and how many COVID cases and fatalities are specific homes, like Ohio and Connecticut's doing? Legal experts say that there's no HIPAA issue here.
Okay, you want to speak to that, Dr. Jim?
We put out the nursing home death data by county yesterday, and as you could see, some of them had 1 case. What we're worried about is personal privacy protection, working with the Department of Health. There's more than, there's about 600 nursing homes in the state. This goes for hospitals as well. There's some very small hospitals where they report out 1 or 2 deaths a day. We just want to go through the data and make sure we're not releasing any potential personal information, and as soon as that's done, that will be made available for people. So that's why we put the aggregate numbers out by county. That's what we're going through.
We're getting reports of specific outbreaks at different nursing homes, so it's hard to tell. But, you know, are there any nursing homes in particular that the state's seeing a huge problem at?
We're seeing issues, like I talked about yesterday, in hospitalizations in different parts of the state. We look at total beds being used, we look at deaths, we look at all of that. In certain downstate parts of the region, New York City, in the outer boroughs, and Nassau County, we have seen increased cases, but that has gone across the board, whether it be hospitalizations or nursing homes as well. So that's now part of the county data that you do see.
Ms. Hogan.
Yeah, earlier you said that there's been 60,000 cases that you guys have the capacity to do a month. But, so one, is that true? 60,000 a month. But then Mayor de Blasio said that they're going to start being able to do 100,000 tests a week. 50,000 homegrown efforts, 50,000 purchased from an Indiana company. So how does that coordinate with state efforts? And again, is that 60,000 capacity correct?
The signed on the dotted line, what's happening with the testing companies is the same thing that happened with medical equipment, PPE and ventilators. There are just a handful of companies that produce the private tests, and they're all private tests, by the way. A handful of companies that do it, and now every state is going to those companies to buy the tests. I've spoken to the head of the several companies myself, and they have a limited production, and now they have to allocate it to 50 states. And we're again in a bidding war competition with other states. I would say to the federal government, you take that piece. Don't replicate the 50-state pandemonium. You want to talk about an increased federal role. Let FEMA do the testing. FEMA should have, in my opinion, done all the purchasing of the medical equipment, and they should have allocated it. Why am I now competing for private testing capacity and private testing machines with Illinois and California? I want to get out of the eBay competition business for vital medical equipment and now vital testing. I would say to the president, you take it. God bless you. Because you have different bids and different promises from companies to different governments all across the country. Like I bought 17,000 ventilators, and then I didn't get, we only got about 3,000, 2,500. The same thing's going to happen with the testing.
But how come the city can get 50,000 made a
Well,
week,
that's
but the
what,
state can't?
well, they're told that from a company. Do I believe we're going to see those numbers actually produced? No, because I think the same thing is going to happen that we just went through for the past month, where those companies are going to get oversubscribed, they're then going to bid up the price, and it's going to go to the highest bidder. We learned this lesson. I saw this movie. I just lived it for the past month. It cost taxpayers tremendous amounts of money. Private companies got very rich. You want to talk about going to a new phase with a different model? Let's inform it from the past model. Tell FEMA, you buy all the tests for the country, allocate them by need. This is where the cases are. New York, you're X% of the cases. Illinois, you're Y% of the cases. Massachusetts, you're Z% of the cases. The federal government is going to buy them, and then the federal government is going to allocate them. Not this, you know, let's give each government or level of government functions that they perform best. And one of the really painful lessons was all this crazy competing by states and cities for medical equipment. We're going to do that again? That makes no sense.
Governor, the accuracy of the serological tests, and what's the plan if those can't get scaled up in the way that you think is needed to reopen?
What is the accuracy, would you say?
It varies. There are many different tests there. We're looking at the tests that have, over 95% accuracy. We are working to scale this up both by our public lab, which is our state lab, the private sector labs that are out there. We're looking at those, as well as the hospitals, which have labs as well.
Address the false positive issue, because if someone goes back to work but they don't actually have the antibodies like the test says, and then that creates its own problem.
Well, we are looking at that. For example, our state lab, the test that we've developed is basically 6 standard deviations out, which basically means that you're really way up there over the 99% accuracy, if not higher.
But you are right. Can I just follow up? You are right. There are different private sector tests